a serious but manageable chronic condition. At the same time, our surveillance data tells us that despite ongoing investments in HIV prevention, new HIV infection continues to occur and rates are not declining, and in both Canada and the United States, there is still a high rate of new infections within certain groups, such as gay men and other men who have sex with men, and people who inject drugs. So despite our investments in the general well-being of our populations, preventing HIV transmission remains an urgent public health priority, and to make meaningful progress, we will have to find ways to refocus our prevention programs to make them more effective, especially for those who are most at risk. The political declaration that both Canada and the United States joined last year at the UN high-level meeting recognized by consensus that the epidemic affects every country differently, and that is certainly true for our two countries. While we have a great deal in common, the composition of our country is very different, and so too is the epidemic. So nonetheless, Canada and the United States have a lot to learn from each other's successes and challenges. By comparing our approaches, I hope that we can help each other become more effective at preventing new infections and addressing the treatment and the care and the support needs of those living with HIV and AIDS. It also provides us with an opportunity to look at ways that our two countries can continue our long-standing history of collaboration and to address HIV and AIDS in North America. Canada's federal initiative to address HIV and AIDS guides the funding of research projects supporting community groups which